Welcome everyone, wherever you are. My name is Rawa Oje and I will be your host for this panel about child and adolescent mental health, part of Wish 2020. We are hearing more and more stories about children committing suicide, and for most cases, most parents wonder, how did we not know? It is not easy for parents around the world to admit that their child needs mental health care, because no matter how you look at it, as a parent, you always feel like you failed your child at some point. Depression is not the only disorder, of course, and most of us are not even trained to notice symptoms. And even when you are open to take the step of seeking help, there are lots of challenges you will face. We will talk more about this with Dr. Samia Al-Abdallah here with me. She is the Senior Consultant of Family Medicine and Executive Director of Operations at PHCC, the Primary Healthcare Corporation in Qatar. We also have with us Dr. Sana Al-Harahshi, Senior Associate of Research and Policy at WISH, and Dr. Ahsan Nazir, Division Chief of Child and Adolescent Psychiatry at Sidra Medicine. And we also have with us Professor Shekhar Saxena, Professor of the Practice of Global Mental Health at Harvard T.H. Chan School of Public Health. Feel free throughout the panel to send us your questions and to whom you would like to address it. We will try to make this conversation as interactive as possible. That's why I ask each of my panelists to try to restrain to 3 minutes in answering my first round of questions. Then we will move to your Q&As, so make sure you send us your question as soon as it comes to your mind. Meanwhile, tell us as well where you are watching from and send us a photo on any of our social media platforms at Wish Qatar with the hashtag #VirtualWish2020. So let's start with you, Dr. Al-Harahshi. Can you begin the session by giving us a brief overview of the Wish report for this year regarding the topic? You need to unmute your phone, your computer.
Hello, everyone.
Now?
First, I would like to...
Perfect.
Can you hear me? Okay. Hello, everyone. First, I would like to thank all the contributors to this report, starting with Dr. Ahsan Nadir and Dr. Saxena and Dr. Samia Al-Abdallah and Dr. Muhammad Waqqar from Sidra and Susan Cleland from the Ministry of Public Health and Ian Tolley from HMC. Mental health is an integral part of overall health, and it is wisely said that there is no health without good mental health. Childhood and adolescence is a critical period of our mental health well-being, and about half of all the mental disorder begins during this age group and some of them continue to the adulthood. Mental health exists in a continuum ranging from healthy well-being to chronic, progressive, and substantial impairment across different psychosocial domains. Global estimate about child mental health disorder is about 10 to 20% of children worldwide experience mental health disorder. This number has increased significantly as the world currently finds the coronavirus COVID-19. Several biological and social economic factors can lead to mental disorder. When risk factors outweigh the protective factors, the result is the emergence of mental disorder. So better mental health during the early years of life builds a foundation for future learning, health, and life success. While poor mental health can negatively affect children, educational achievement, even their progress and their overall well-being. So this policy briefing provides an overview of the development of the mental health, the development of the services and in mental health and adolescents in Qatar, while referring to the global perspective. Globally, mental health well-being of children and adolescents was covered largely within the World Health Organization Mental Health Action Plan, 2013 to 2015. to and the United Nations Sustainable Development Goals that all countries have committed to achieving by the year of 2030. The WHO Mental Health Action Plan and the United Nations Strategic Development Goals, Target 3 and 4, and other initiatives have increased awareness about mental health among children and adolescents and their needs, and have strengthened the global commitment to improve the well-being of children and adolescents. Mental health is a fundamental human right. Several policy documents have been established to provide a framework for countries and government to ensure that children with mental health issues and psychosocial disability, they are protected and they enjoy their rights without discrimination, such as the Convention of the Rights for a Child and the Convention of the Rights of People with Disability. Qatar is one of the countries that signed and framed the UN rights for the Convention for Children and People with Disability, and guarantees civil rights for children, and one of them for physical and mental health. At the national level, during the last decades, Qatar has made significant progress toward developing a World Health Class system, in part because of the ambitious and visionary goals set out in the Qatar National Vision 2030 and Qatar National Development Strategy and Qatar National Health Strategy and the Qatar National Mental Health Strategy. Now I am going to talk about the progress in Qatar with regard to mental health among children and adolescents in the following areas. With regard to the policies in Qatar, a formal mental health policy was established in 1980s. In 2018, the Supreme Council of Health, currently the Ministry of Public Health, formed a National Mental Health Committee with assistance from the WHO to improve the mental health services in the country. Later, Qatar adopted the WHO Mental Health Action Plan 2013 to 22. In 2013, the Qatar National Mental Health Strategy was launched under the title Mind Changing Life, emphasize the transition to community-based care, raising awareness about mental health issues, and developing a sustainable mental health workforce and enacting the mental health law. Additionally, following the publication of the World Innovation Summit for Health, a global research study in 2016, Autism, a global framework for action, the Qatar National Autism Plan was developed based on that in 2017. In line with the WHO EMERO region recommendation on the development of mental health services, Qatar Mental Health Law was issued in 2016. However, this law does not explicitly address the mental health issue among children and adolescents. Mental health and well-being governance. In 2018, the Ministry of Public Health announced mental health as one of the main area of focus and created different work streams under mental health and well-being task force. The main aim of this work stream for children and adolescent mental health service is to develop and implement a comprehensive care pathways of care to support children with mental health issues. Over the past decades, Qatar health sector has undergone significant expansion to provide a range of high-quality healthcare services. Although children and adolescent mental health service in the state of Qatar has traditionally lagged behind the adults and elderly initiatives, the children and adolescent mental health service has transitioned from being virtually...
Dr. Sana?
Yes.
Yeah, let me go to Dr. Al Abdallah with the challenges, and I will come back to you at a later stage with the recommendations that came out of the WISH report. Dr. Al Abdallah, as the executive director of one of the leading healthcare provider in Qatar, what are the challenges you notice still in Qatar for child and adolescent mental illness healthcare?
Yes, let me first thank you all for giving me this opportunity. I'm happy that you addressed this question, the challenges, because it is a global issue. And Qatar is no exception to this, to these challenges. We know that there is a recognition that the existing mental health service for children and adolescents is understaffed. So we have a lack and insufficiency in the mental health professions are trained in a proper and right skills to do assessment, diagnosis, and management of such mental health condition and disorder here in primary health care. So this is one of the main issue, lack of trained staffs and understanding within care health provider. The second important challenge is the stigmatizations, and I'm sure all of you know how is this fear and shame of stigma can affect approaching mental health services in anywhere this is a global issue, and we have this issues whether in the schools or in the community. So we have to tackle this issue and to ensure that we have a proper way and a proper approach. How can we overcome the stigmatization issue? Another issue is data and research. Mental health is, as Dr. Sanashi mentioned, in adult we go far away. And to be honest with you, Qatar show a significant progress in all health aspect and all health system, and we reach a world-class health system in all aspect. But still in mental health, especially for children and adolescents, we are lacking little bit behind. And to be honest with you, this is a global issue and everywhere, but still we have to reach our goals and objectives. So lacking of this data and a proper research, it make also how can we address the main issue and the main health need, especially in children and adolescents. Another issue is also lacking of monitoring and evaluations, which also give us a challenge and a barrier. How can we find the gaps in the system and the gap of in the mental health in particular for children and adolescents? One more challenge is lack of public health awareness. Public health awareness and still is lacking behind. One more thing is we also have a little bit behind the school-based mental health, mental health educations, mental health counseling, mental health. How can we? Not every schools in Qatar are having enough number of clinical psychologists, which can which can address this mental health issues and link our student to a proper channels to get help and seek. One more thing we observed in the recent years, that excessive use of digital technology. So we can see a lot of your children that most of the time they use the technology. And there is a recent study done here in this Northwestern University that 100% of Qatari children, they have access to full-time internet, which, simple statistics show that they are spending more than 34 hours a week on the internet. So, and this will lead to a lot of mental health issues like depression, anxiety, loneliness, sometimes online bullying, and sometimes even they think of self-harm, suicidal ideation. All these things, actually, we have to address it when we are looking for solution.
They are exposed to violence and hate speech. I don't even use my phone 34 hours per week. Dr. Nazir and Dr. Al Abdallah touched upon the importance of awareness campaigns. Can you tell us more about the Are You OK campaign that Sidra and Ministry of Public Health recently launched, and how it specifically targeted young generations?
Thank you, Rava, for the question. I think Dr. Samia has really uh, highlighted some of the main challenges that we have been struggling with over here. And when I say struggle, I think it's a kind of like a good struggle, because in the last 3 or 4 years, we have seen a significant improvement and has moved forward in providing the best care possible to the children. So there are research studies within Qatar and within the surrounding areas that talked about the stigma, as well as the lack of mental health literacy. And so basically what it means is that most of the people, they do not really understand the basic reasoning of the mental health. What exactly is a mental health, and how a good mental health can be very different than a not so good mental health. And at a level, I will say, like, sometimes it gets really shocking, because when we see the patients over here in our clinics, we have to start sometime at a really, really basic level, like about how the brain develops and what are the stressors of the brain and how things move on from there. In the last 2 to 3 years, actually more than that, Ministry of Public Health has taken the baton and moved forward with these multiple campaigns over the course of these certain days, for example, Autism Spectrum Day or World Mental Health Day. And these are very well organized programs in which numerous organizations are involved. So the organization is one, and then Primary Healthcare Corporation is involved, then NOFR is involved, Qatar Foundation, Hamad Medical Center. So we all come together around a table and then figure out a theme that we feel that will be better able to address the situations in the community. And this year's campaign on the World Mental Health Day was "Are You Okay?" And basically, what we were trying to achieve is to educate the people on some of the really basic symptoms of stress. Okay, stress and depression. For example, someone is feeling sad, someone is crying, someone is feeling hopeless, problem with eating, problem with appetite. And I think that was very relevant, especially with the COVID-19 issues, when 9-10 months everyone is locked down in their home. So what we basically did is that we started this campaign is telling the people that these are some of the symptoms that you can look in your family members, in your children, in your colleagues, and any other your friends. And if you see that there is some red flag, then you should at least start a conversation with them. And the conversation, the best way to start a conversation is just say, "Are you okay?" Because this is a culturally appropriate question. But by saying, "Are you okay?" I think that's also a little bit tricky, because you're meeting someone in a corridor and you say, "Are you okay?" And the person say, "Yeah, I'm okay." And then you wipe your hands and move on your own. So that really was not really the way to go. So then there was a little bit of education. Okay, you need to find the right time. You need to find the right way. You need to find the right place to ask the question, "Are you okay?" or not. So first education about the symptoms, then "Are you okay?" And then the question is that if the person say, "Yeah, I am okay," and then how you're going to follow up on that. And the follow-up is, "Are you sure you are? Because I've been noticing that you have been down for the last couple of days." So that gives an opportunity for the other person to trust you and to build some rapport and then come up. And then the third phase of that is that what if the person say, "Yeah, I'm severely depressed. I'm having a lot of suicidal thoughts. I'm not really doing well." Then how are you going to handle your own emotions? There's a lot of countertransference. So, okay, well, so what we told them is that, you need to be calm, you need to be non-judgmental, to keep a sportive stance, and sit and engage with them in the conversation. And if you feel at a really basic level that there are some difficulties going on, then help them find the right resources in the community. And in that campaign, the right resource in the community that we thought will be most beneficial will be the Qatar Mental Health Campaign. It's 16,000, and that's manned, I think, about 12 to 16 hours by different hospitals. And people can call them and people can receive some appropriate help. So I think this was a wonderful step in a very culturally appropriate way to raise awareness and to handle some of the stigmatization that Dr. Samia just talked about.
And many corporations and schools adopted the campaign and emailed it to students and to employees in order to raise awareness about it. Professor Saxena, taking a more global view, how do the challenges within child and adolescent mental health care in Qatar compare to those globally? Are there any key differences or similarities?
Thank you very much, Rava, and I'm delighted to join the discussion, and my other panel members have already discussed quite a few things. I would like to add 4 issues to the discussion very briefly, but I would recommend to all listeners to actually access the full report on the website because there is a lot of other material there. The first issue I would like to raise is that mental health is ignored everywhere in the world. But child and adolescent mental health is even more ignored. So it's doubly neglected in a way. And that's the global phenomenon. So Qatar is not an exception. It is not surprising that Qatar has made less progress in the area of child and adolescent mental health compared to the overall mental health and compared to the overall health. So there is a gap. There is things to do in the coming few years, which is very important. The second point I want to make is that although Dr. Sana mentioned the figure that 10 to 20% children might have a mental health problem, we should actually target all the children because mental health is a dimension. Mental health is a continuum, and it's important for all children and adolescents, whether it's for promoting their mental health, whether it's for having optimal emotional development for them, or is it to identify any problems and treating them? So we must deal with mental health as a continuum and not divide the world into 2 groups, people who have a mental disorder and other people who don't have. It is important for everybody, including me and you, and also for all children and adolescents. And that really brings to the point that promotion and prevention of mental disorders becomes extremely important. It's not only about treatment. It's about seeing to it that treatment is not necessary. The third point I would like to make is that it is a whole of the government issue and approach rather than just the Department of Health. So other departments and ministries like the Ministry of Education, the Ministry of Child Protection, Social Support, Law, and many other ministries are extremely important in the area of child and adolescent mental health, especially when we take the mental health as a continuum and not as a binary division between people who have a disorder and people who don't have. The last point I want to make is that Qatar is actually in a very good position to make quick and good gains because it has the infrastructure. It just requires more attention and some more investments to do that. And the returns on investments from global literature have suggested that the returns are extremely good. The work done by me when I was working for the World Health Organization along with some colleagues have suggested that the returns of investment on mental health is at least $5 for each dollar invested. And in the area of child and adolescent health, the returns are even going to be larger. So it really makes sense for us to invest in the child and adolescent mental health, but only larger investments is one part of the story. We need to also invest smartly on those interventions, especially for promotion and prevention, which have the largest impact and the largest return. So we need to pay more attention, we need to invest more, and we need to invest wisely in the area of child and adolescent mental health. Thank you.
Thank you, Dr. Saxena. You touched about Qatar having the right infrastructure. Dr. Sana Al-Harahsha, I go back to you with a question. You talked about the things Qatar achieved in the past year since 2013 to provide a better mental health care. What needs to be done? What recommendations did the report come with?
Actually, we recommend adopting the following action plan to achieve better mental health for children and adolescents. We need to develop a comprehensive, integrated balanced and responsive child and adolescent model in mental health for services across the whole care system. Also, there is a need to develop and implement the whole of the government policies and the human rights legislation to protect and to promote the mental health of children and adolescents. Involve community, parents, teachers, healthcare providers, when establish any program, any promotion program or policy establishment of policies regarding mental health among children, even including the voice of young children, the youth. Establish post-monitoring and evaluation system for child and adolescent mental health and invest in research. Until this moment, there is no prevalence study about mental health of children and adolescents in Qatar. There are some research about adult mental health issue and a few limited research on child and adolescent mental health.
I think Dr. Sana cut off. I'll pick up on that and go back to you, Dr. Abdullah. The thing that Dr. Harahshe and yourself, you mentioned the lack of study is mainly also because mental health of child and adolescent is managed by parents who tend to delay as much as possible admitting that their child needs mental health. And when they do, they're not really open to talk about it. How do you fight stigma within Qatar? How do you raise awareness among parents that this is for the better being, maybe for the entire family? Is there any study that shows are other siblings affected by mental health or disorder of one child in the family if not treated properly?
Yes, I think this is really an important challenge because as Dr. Sana, she mentions, we have a lack of really research, especially for all mental health, but certainly mental health child and adolescent are lacking behind. So till now, we don't have any data on a prevalence of mental health issue, although we are seeing a lot of patients in our clinic. For example, we can see a lot of children coming with anxiety, depression, suicidal ideations, eating disorder. All these are common, but we need a proper, data collections and a proper research. If we can find all these data available, we can we can also do some analysis of the health need among this particular age group. And you address something important, that we should start early. Mental health and well-being is important. It's not only for health professionals. We should start in the schools, in the community. We should even involve the children and the families and caregivers. We should engage them in policy making, in decision making, in the care planning. We should raise the public awareness, and we should use everything, all technology, especially that we see a lot of community, they are using a technology. So why not to use this technology to do some online mental health community? So children and adolescents can address their mental health issue there, can discuss it, and somebody can, get this information and guide them where they can get the proper care.
Dr. Nazir, I will go for you for a question coming from the viewers. Does inequality among children and adolescents in the same school contribute to depression and other mental health issues?
Yes, it is. And I think this is much more of a global phenomena than a phenomena that is localized in these countries. Like Qatar is a multinational country. It's kind of, there are 95 nationalities over here in this country. So I think one of the things that we need to understand, what Dr. Saxena very clearly put, is that when we see the mental health, we see the mental health on as a continuum. As a child psychiatrist, we believe that from the early infancy to late adolescent years, there are certain periods in their growth in which the kids are more prone to the development of certain disorders, and let alone be anxiety disorders, major depressive disorders, psychotic disorders. And then on the top of that, there are certain kids who are more prone than to the general population. And some of those kids are basically the immigrants, the kids who have chronic medical illnesses, the kids who come from the broken home with the divorced families, the kids who are abused, the kids who are segregated in schools or in other communities, the kids who are bullied. So all those factors basically they lead to an extra layer of the stress on the child's growing mental health. And children really don't have that type of flexibility that probably all four or five or the audiences have. They are very dichotomous. They are more like, okay, well, red or black and white. They are not really think in an abstract or in a gray area. And that makes them really prone to the development of these mental health disorders when they feel that they are not being treated, they are being segregated, they are different from other people. Coming to the question to your audience.
Dr. Saxena, sometimes children are stigmatized by their own parents. As a mother myself, I notice sometimes that we raise our children now differently. Some of us use the modern education techniques, which we have no background with. We were raised with our moms telling us, don't be sad, there are children dying somewhere else in the world. So you are not even allowed to be sad or depressed or down. So with these differences, even within the same generation, with this different approach by parents, where does the government come in? What's the role of the government and what's the role of parents, and how can we improve mental health for children?
Rava, you're asking a very important but a very difficult question. Obviously, there is a role of parents, and we do know that parents are the ones who spend the maximum amount of time with their children, at least till the time they become adolescents. After that, they perhaps spend the least amount of time. But it is very important for parents to realize that the world is changing. In fact, the world has changed. And during the pandemic, it's also changing much more rapidly because children are spending a lot of time at home, which they actually spent earlier in the schools. So we need to have new ways of dealing with the problems compared to the past. And sometimes our own old rules don't apply. For example, in fact, Dr. Nazir raised the question of the use of technology. Children are obviously spending a lot of time on internet, on various devices. And all of that is not really bad. In fact, there is a report which will be published tomorrow, which is on examining the technological side of the use by children. And there are many positive things also. They are learning more, they are interacting more, and sometimes during the lockdowns, that's the only method by which they can actually learn. But yes, there are negative sides, and parents are sometimes in great difficulty in decide how much is okay and how much is too much. But my point is that it's not how much time the children are spending on internet. It's actually what they are doing on the internet that is extremely important. So parents have a responsibility to actually be aware about what their children are doing, how they're spending their time, and are they in some kind of danger because of the bullying or other kind of cyber security issues. So that is very important. You asked a question about the government's responsibility. I think the government has a major responsibility in seeing to it that children are brought up in an environment which is safe. So for example, for internet security, government has a responsibility. For providing good education, government has the responsibility, and providing guidelines about how parents should deal with the mental health issues and actually prevent them. Government has a responsibility by providing the kind of evidence-based guidelines, which will be very useful. And globally, we are making some advancement on that. And I'm told that even in Qatar, there are various research and information exercises which will lead to very good guidelines so that parents are not at a loss to decide what to do. They have something proper to take help from. Thank you.
Dr. Samia, which sectors of the government need to be active for promoting mental health care across Qatar? It's not only the responsibility of the Ministry of Health, for example.
Yes, it is. We should all work together. It is not only a responsibility of mental health and health professional. It is responsibility of all ministries. For example, Ministry of Education, they have a lot of, a lot of rules there regarding the schools and type of, how can they support them in the schools with whether to a proper approach and a proper approach, and how to deal with these kind of mental health issues. And I know in the school of Qatar they start to do this. So some school of Qatar, they have a clinical psychologist in place and also a mental health social worker who can address this issue. But still, it's not available in all schools, and still probably they need more orientation, more training in this regard.
Dr. Nazir, why should the world focus on child and adolescent mental health, and what type of struggles you see in children and adolescents in Qatar?
So, Rava, I think most of the things that are important, the participants have already talked about. And I think one of the main important message that, at least I think it's important to give, is that it's really important to understand what Dr. Saxena said, is to see the kids or see the mental health disorders on a continuum. If you don't see that, the problem is that about 50 to 60% of the mental health disorders, they occur before 14 years of age. And about 75% of them, they occur before 18 years of age. And if they are not treated at the right time with the right interventions and the right modalities, then most of the kids, when they grow older, they carry with themselves a huge baggage with a chronic mental illness, as well as kind of like a lack of a sense who they are in the world. And then they go into a whole slew of problems that increase the morbidity and mortality. And we know, like Dr. Saxena, I think it is in the WHO report also, that the people who have a diagnosis of major depression disorder, there's 60% more chances that they will die prematurely as comparison to the general population. The same is true for schizophrenia. There are 40% more chances that they will die prematurely. Now, by the way, we're talking about the research and the studies. Definitely, there need to be prevalent studies in the Qatar. But there is a study, a global burden of disease study from University of Washington in 2015, and they say like a top 3 most burdensome diseases among the 6 diseases in Qatar, they are the mental health related. They are major depressive disorder, anxiety disorders, and the substance abuse disorders. Now, if you look at the chronicity of those disorders did not start when the person turned to 24 or 30. There may be some bimodal presentation, like there are some disorders who present in early childhood and then in the later. But majority of these 3 diagnoses, they start when the kids are 14 to 15 years of age. For example, major depression disorder, like a very prevalent from 14 to 18 years of age. And I think it's the 4th leading cause of disability in that age group. Anxiety is the 6th leading cause of disability from 10 to 14 years of age. So the whole issue is the whole continuum, and how to pick up these kids during the early childhood, how to identify them, how to build systems in the community, in the schools, and in other organizations, so that these people can come to light and then can refer to the appropriate resources. And there is a good saying, I think Frederick Douglass said that it's easy to build a strong child, but it's very difficult to repair a damaged man. And that's basically what it is, that we can pick up these disorders when the kids are 35 and 40. But trust me, I'm a child psychiatrist. I'm working in this field for 20 years. It's a lot easier, lot engaging, and lot beneficial to handle them when they first arise. So yes, we believe in early diagnosis, we believe in early intervention, and we believe in early care at the right time. That's what the whole goal is.
Speaking of early intervention at the right time, Professor Saxena, how was the ongoing pandemic exacerbated mental health issues for children and young people, and what can we do to minimize the long-term effects on them?
Well, again, a very important question during current times. The pandemic has affected the lives of most of us, and children and adolescents are also facing a number of issues. As I referred to earlier, sometimes they're not able to go to school, their learning is getting compromised, their social activities are getting compromised. So eventually, there is going to be a impact on their development delays, development disorders, and learning disorders are going to come up, which is a very major problem because, as Dr. Nazir was explaining, any major stress or any major neglect during early childhood is going to have a much larger impact during the adulthood time. So this is the time for us to actually prevent those things. What can be concretely done is, one, to take care that the children and adolescents have as much of a normal life, even during the pandemic, as possible. Of course, seeing to it that they remain safe. So that is one important thing. Their learning has to continue by whatever means are possible, but their social life is equally important. Many parents think that if the child is learning well, then their job is done. But for the child and for the proper development of the children, their social and emotional life is equally important. So we need to pay attention to that, and we need to make sure that the children have enough stimulus and enough capacity, enough access to their friends so that they can actually communicate and get the kind of social stimulus that they need. So that is again very important. And the last point I want to make is to see to it that the parents recognize the early signs of stress and other problems during children, especially during the COVID time, because that can actually start a process which sometimes can be too late to then do something about. So they need to be talking to children, they need to be keeping a watch about what's happening to their lives and seeing them through their eyes rather than the eyes from the adults, which is something that we find it difficult to do many times, but we need to do that and seek help early, as Dr. Nazir was saying, rather than to wait for that good time to come in. And those are things that every parent can do. Mm-hmm. This is not something which requires much more knowledge. It requires just a little bit of a sensitivity and being responsive to the children's need. And otherwise, if we don't take care of that, some of these traumatic events in the life can become a long-term burden, and we must avoid that.
Dr. Al-Abdullah, very quick question. We have 2 minutes remaining. What cultural barriers do you think still persist in fully addressing child and adolescent mental health issues?
Still, yeah, thank you for addressing these questions. Yeah, still we have, in an area in the community where, as Professor Saxena, that people, they have a fear and shame for approaching any mental health professionals. So the stigmatization is really exists in the community. So that's especially in this part of the world.
So just think of it like when you're bleeding, it's the same thing. Your soul, when it's bleeding, when your mental health is bleeding, just seek help the same way you would do it if your body is actually bleeding. Thank you to my distinguished guest, Dr. Samia Al-Abdullah, Senior Consultant of Family Medicine and Executive Director of Operations at the PHCC, Dr. Sana Al-Harahshi, Senior Associate of Research and Policy at WISH, and sorry for the poor connection in the middle of the conversation, Dr. Ahsan Nazir, Division Chief of Child and Adolescent Psychiatry at Sidra Medicine, and Professor Shekhar Saxena, Professor of the Practice of Global Mental Health at Harvard School of Public Health. Stay safe and healthy, and we will hopefully see you in person next year.